Hello, and welcome to this breakout session. I am truly excited that you have decided to join us today. We are looking forward to continuing our look at early, broad, and sustained investments in children and families, and to an active and engaging discussion in this session. This session will look specifically at how the Build Back Better bill planned to invest in children, what was lost when it did not pass, and a look at where we go from here. I am Dr. Sunny Munn, and the Director of Evaluation and Innovation here at the Crane Center. I am pleased to welcome my colleague, Dr. Lauren Jones. Dr. Jones is a Crane faculty associate and an associate professor of human sciences at the John Glenn College of Public Affairs here at The Ohio State University. She studies government policies that affect children, families in low-income households, and other vulnerable populations. Dr. Jones' research interests are in social policy, health, and consumer protection. Her work aims to identify how public policy can improve family well-being. Dr. Jones earned her PhD at Cornell University and has been published in top journals and covered by major media outlets, including the New York Times, the Wall Street Journal, Bloomberg News, and the Freakonomics podcast. She also engages in applied policy work, consulting with state and provincial governments on how best to support children and families. As you can see, Dr. Jones brings a wealth of knowledge and experience, and we are thrilled to have her here with us today. I invite you to join in an active and engaging discussion via the chat and Q&A boxes. We are all here to learn together and be inspired to take action in our own settings. My colleague Caitlin will be monitoring our chat box and keeping you updated there with any housekeeping items. I will return at the end of Dr. Jones' presentation to facilitate our Q&A conversation. And with that, I'll turn it over to you, Dr. Jones.
Thanks so much, Sunny, and thank you to everyone for being here today. I am really excited to talk about this. As I was preparing my slides, I also realized that it's a bit of a sad discussion for those of us who care a lot about early childhood. The reason it's sad is because I'm going to be talking about the Build Back Better bill. I'm going to be talking about what we could have, what was within our reach. We didn't quite get there, but ending on a positive note, hopefully to kind of help direct us in terms of our advocacy work going forward. So just to make sure we're all on the same page, Build Back Better was the federal bill introduced by the Biden administration in the kind of, aftermath of COVID. I mean, COVID's not over, but the aftermath of the big, main pandemic time. And the bill included a vast expansion of social safety net programs, including several provisions for children intended to improve educational opportunities, lower poverty, et cetera. If you were here this morning, when we were in person, it was kind of discussed about how historic this bill was and how significant it was. The bill did not pass due to a variety of reasons. And so what I want to talk about today is go over a few of the kind of large provisions that the bill offered, give you a sense of what we were left with when the bill didn't pass, and then also give you my sense of kind of some fruitful directions for advocacy at state and local levels as we kind of continue to push for the things that were promised in the bill. And I'm also looking forward to continuing the discussion after my talk in the Q&A. So, as I'm talking, you can go ahead and pop questions you have in the Q&A box, and I'll be excited to answer them after the talk. So just to kind of frame what I'll be talking about today, I want to emphasize the point that social policy is redistribution. So the way we kind of, structure our tax and transfer policy in this country is we generally tax higher earning or high wealth individuals and companies, and then we use those funds and the tax revenues to fund what we call transfer programs generally, which are, tend to be more targeted towards low and moderate income households. So the way we kind of, you can kind of think of the transfer programs as being classified into two main types. One way we can transfer income is through direct cash transfers. And the other way we can kind of transfer and achieve redistribution is by providing what we call an in-kind transfer. So this is when we're transferring, we're not giving families and individuals cash per se, we're giving them access to various services. So we can think of in-kind transfers, including things like food vouchers through the SNAP program. So those would be in-kind transfers that are very kind of cash-like. It's a voucher that you can take and spend on specific goods at the grocery store. All the way to the other end of the spectrum, where we have programs like our big K-12 publicly funded education program, Medicaid and Medicare, these big kind of transfer programs, which are transfers, but they're really kind of structured in terms of providing the entire service, rather than just giving families cash and expecting them, for example, to purchase health insurance or access to education themselves in a private market. So what did Build Back Better do to expand social policy and expand these redistributive policies for kids? So in terms of cash transfers, the big kind of expansion that we saw for kids was the expansion of the child tax credit. Excuse me. The bill also had, excuse me, significant in-kind transfers, expansion. Sorry, I'm just having a choke, so I'm gonna put myself on mute for a second. Apologies, I'm not sure I had something stuck in my throat. I'm hoping I'm going to be okay now. Okay, so we had big expansions to cash transfers for the child tax credit. We also had expansions to in-kind transfer programs for kids, specifically in the form of expanded housing, nutrition, and health programs. And finally, we had significant expansions to education, specifically early childhood education programs through several publicly funded early childhood education initiatives. So today in my talk, I'm really going to focus on the cash and publicly funded publicly funded ECE programs that Build Back Better offered. Even though I also want to kind of outline that the other in-kind transfers that Build Back Better was promising for kids were also really significant, especially the nutrition one. And we have another breakout session going on right now, focusing on the nutrition expansions in particular. But today we're really going to focus on the cash and education expansions. So let's start by talking a little bit about the child tax credit. So just to frame the discussion, I want to point out to everybody that tax credits, so these are income transfers, cash transfers to families that are administered through the tax code in the form of tax credits. A tax credit is just what it sounds like. You owe some amount of tax to the government, and you're credited back, you receive a credit against that tax owing. Tax credits can be refundable. Refundable tax credit means that even if I owe less tax in total than the value of the credit, I'll get the cash back in equal to the kind of value of the credit that exceeds what I owe in my tax liability. Non-refundable credits, on the other hand, are credits where if I owe $1,000 of tax and the credit is $2,000, for example, my tax liability, that $1,000 I owe, will be eliminated, but I'm not going to get the extra $1,000 that comes from the credit. So I'm not going to be refunded that extra funds. So Refundable tax credits are the primary means of cash transfer in this program or in this country right now. So this graph that I'm showing here essentially shows going back to 1975, total federal spending on 3 cash transfer programs. In the yellow line, we have 10F, which is welfare, the welfare program, formerly called AFDC. You can see that funding for this program has been pretty constant over time. The blue and red lines, by contrast, which illustrate the earned income tax credit, which is another big tax credit program directed at low-income families with kids. And then the more recent child tax credit, illustrated in red, you can see there that the funding for these 2 programs has grown and in fact dwarfs now funding for traditional welfare. So just to kind of frame what we're going to talk about, I want to illustrate the fact that these tax credits are an incredibly poverty alleviation tool. And they're also the primary means that we have in this country for directly transferring cash to families. So what did Build Back Better offer in terms of expansion? So, the expanded child tax credit has gotten a lot of discussion. I want to talk a little bit about some of the specifics of what the expansion looked like. So the graph on the left on the slide here shows in the light gray line the child tax credit schedule before the expansion. And actually, this is also the schedule now that we're facing this year, now that the expansion was not enacted in Build Back Better. And then the 2 blue lines, most relevantly, show the expanded child tax credit. So the way to read this graph, along the bottom here, the x-axis going from left to right, you've got the family's household earnings increasing. And then going up the y-axis here is the value of the tax credit that the family will get. So there's kind of 3 things you want to think about when you're evaluating a tax credit. First is the credit amount. That's going to be how high up the credit goes on this axis, right? So we can see the former credit and the credit that we have now caps out at $2,000 per family. Part of the Build Back Better expansion was to increase the credit amount up to $3,000 or $3,600 for kids under age 6. So Build Back Better kind of increased the total credit amount. Next thing you want to think about when you're thinking about and evaluating a tax credit is how far the lines go out this way along the adjusted gross income axis. So the farther, this is what we call typically the phase out range of the credit. The farther along this axis we go, the more higher income households get the credit. So what you can see is that both for the current child tax credit and the expanded credit, the phase out range goes all the way up to $200,000 for single parent household, and actually for 2 parent or 2 adult households, the phase out range goes up to $400,000. So that means families with up to $400,000 of earnings are getting the full value of the credit. The final part of the tax schedule is what we kind of see down this end. This is essentially telling us what, on the one hand, is the refundability of the credit, and what's the earnings test of the credit, and what's the phase in of the credit. So this is the feature of the Build Back Better credit that I really want to focus on. What you can see is that in the expanded credit, we've got kind of no phase in range. What this means is that any household with income below about $130,000 a year was getting the full value of the credit. So this includes families with 0 earned income and families with low tax liability. This was the refundability aspect of the expanded child tax credit that many researchers and policymakers were really advocating for. What you can see if you compare that to what we're left with, this kind of angled line down here, you can see that we've got a range down here. This is households below $2,500 in total household earnings. They get 0 tax credit. That's because of the earnings test. This tax credit is earnings tested, which means you need to earn at least something in order to be eligible for the credit. The phase in you see here comes directly from the refundability. So the fact that the expanded tax credit was fully refundable meant that all lower income families got the full value of the credit, whereas what we're left with is essentially lower income families getting or only a portion of the credit, because only a portion of it is refundable. So just to give you a kind of hard example of this, let's take 2 families, both with 2 children. One owes total taxes of $5,000. The other owes total taxes of $0. Generally, this $5,000 tax liability family is going to be higher income. For the higher income, high tax liability family, they're going to get a child tax credit of $4,000, whereas the lower income, low tax liability family is only going to get a credit of $2,800. And that's because the credit that we're left with when Build Back Better did not pass is not fully refundable. I wanted to just highlight what this impact has based on some new research focusing on who actually benefits from the child tax credit. So because of the fact that the child tax credit is not fully refundable, and because of that earnings test, meaning that you need to earn something in order to get the credit, the value of the credit is really much larger for higher earning families. So this graph on the left here is showing in white proportion of families that get no credit, in gray the proportion of families that get some credit, and in black the proportion of families that get the full credit. What we can see as we move along the income distribution from the poorest families, the 1 here, to the richest families, 10, is that among the poorest families, only 10% of households only 10% of households are getting some credit, whereas among the richest 60% of households, they're getting the full $2,000 credit. So you can see who's benefiting from the current child tax credit. It's really going to be higher income households. These patterns are also reflected in the race of the children whose families benefit. Essentially, we see that Black families and Black children are much more likely to get no credit or partial credit, whereas white families are much more likely to get the full credit. We also see the same difference when we compare Hispanic and white families. Okay, so let's turn now to some of the public funding provisions for early childhood education that were promised in Build Back Better. So the kind of two that I really want to focus on are first this universal expansion of preschool for 3- and 4-year-olds. So essentially the program was going to provide federal funding to provide preschool for every 3- and 4-year-old across the country. This is what we would typically call a universal childcare program. The other part of the other kind of big expansion to public funding for early childhood was this kind of cap that the policy was proposing on out-of-pocket childcare costs for low to moderate income families, meaning that if you have a child between the ages of 0 and 2 and you're a low to moderate income household, your childcare was going to be subsidized. You were not going to have to pay the full out-of-pocket cost to pay for private market childcare. This is typically what we call a childcare subsidy program. And then the bill also promised to infuse money directly into the private childcare market through grants, et cetera. But I'm going to really focus on these expansions to the universal childcare program and the subsidy program. So when Build Back Better didn't pass, what were we left with? Well, on the one hand, we were left with various state and local programs that provide universal pre-K, universal preschool, et cetera. Florida, Tennessee, New York City, Columbus is working on a program like this. So there's a patchwork of programs that exist across the country. In terms of kind of other subsidized programs, there's 2 big federal ones, one of which is Head Start and Early Head Start. We just heard a lot about that from Dr. Jackson in the keynote talk earlier. So I'm not going to focus too much on that program today. What I really want to focus is on the other publicly funded or subsidized child program that we fund in this country at the federal level, which is called the Child Care Development Fund program at the federal level. Every state then implements their own version of this program. Here in Ohio, we call it Publicly Funded Childcare, or PFCC. What this program does is it essentially offsets the costs to families of buying childcare and buying a spot in an early childhood education institution by subsidizing their care. So the way we do it here in Ohio is that the Department of Jobs and Family Services transfers money directly to the providers for children who are eligible for the program. And some families are required to pay a copay for the program. So the CCDF program is relatively small in that it across the country, it only serves about 1.5 million children per year. So that's not a huge number of children. If we compare that, for example, the child tax credit, over 20 million families get the child tax credit in a year. So, not a huge number of children served, but I'm going to argue that the way this program is administered in states actually has an outsized effect on the childcare market. So I'm going to kind of talk about, even though it's a relatively small, relatively low, kind of minimally funded program at the federal level, it has the potential to really be impacting the way childcare markets are functioning in our country. So just to give you a sense of who is getting the funds and who's getting subsidized subsidized childcare through the CCDF program, I've just pulled a few stats from the ACF. In orange here, we've got the data for Ohio. In blue, we've got the national data. And so I'm just kind of graphing here of all the children who receive subsidized care. What's the breakdown look like by age group? So you can see that we've got a big group of kids, 6 to 13. These are the school age kids who are getting subsidized care for before and after school for the most part. They're kind of using up a lion's share of the funding simply because these kids are older, right? So I'm sorry, not because they're older, because it's a big age group, right? So we've got 6 to 13-year-olds here, whereas all these other age groups are just 1 to 2 year bins. So this age group, the school age kids are using about or represent about 35% of kids who have subsidized childcare in the country. And then you can kind of see the distribution. We've got 3 through 5-year-olds really using the program a lot as well. I've also got some stats here by the race of children who receive the Child Care Development Funds or subsidized childcare funds. And you can see that recipients are disproportionately Black, and that's especially true in Ohio. Okay, so that kind of gives us a setup of what we kind of stood to gain had Build Back Better been passed. What I want to do with the rest of my time is talk through a little bit some of the research we know about the programs that were promised. When we're thinking about now, where do we go from here? I think it's important for us to really think about how best can we direct our advocacy work to achieve the programmatic expansions that are going to get the biggest bang for our buck and the biggest bang for our effort. And which of these kind of directions could be most fruitful when we're working at the state and local level. So that's what I'm going to talk about for the rest of the time. So the first thing we should really think about is like, how do we compare a cash transfer program to an in-kind transfer program like a publicly funded childcare program? And so I wanted to start by just kind of walking through some mechanisms or some theory, a framework for us to think about why these transfer policies could affect children's outcomes. So the first kind of mechanism or channel that would lead the transfer policy to impact kids is because both the cash transfer program and the publicly funded childcare program essentially increases the resources that families have available to them. So cash transfer, it's kind of obvious, right? You give somebody a check for $2,000, all of a sudden they've got more money, they can spend it on whatever they think is an important input for their child. Maybe that's housing, maybe that's food, maybe that's tutoring, right? That's kind of an easy one. But when we provide in-kind programs like a publicly funded childcare program, for example, we're also essentially increasing the resources the family has access to, because now they don't need to cover the full cost of childcare out of their budget. They free up that money. That money can then be used for other inputs like food or tutoring or whatever other thing they need to purchase. So both programs really result in kind of an increase in resources. The next way these policies could impact child outcomes is by changing the work incentives that parents face. So, if you provide a affordable, quality early childhood education infrastructure, we know that that is going to make it easier for parents and mothers in particular to go to work. We also know that spending the amount of time that parents spend with their kids is a direct input to the developmental outcomes that the kid faces. So that's another channel that the transfer policies could, be operating through in their impact on child outcomes. Next, we can think about there being what I call family process effect of these policies. So when I infuse resources into the family, that can reduce stress. It can aid their household finances and reduce debt stress. But if it's also true that when I provide childcare, for example, which could incentivize a family to go to work, that's also going to change the way the family members are interacting with each other, which can then have this direct effect on kids. And then the final channel that I want to mention is the extent to which these policies are going to affect the family's access to quality care. And I'll talk about that more as we go through. So any policy we pass, we can think about the policy affecting child outcomes through these various channels. And we can also think about the channels interacting with each other and kind of creating feedback loops. So for example, I just mentioned this idea that when you change work incentives, make it easier for people to go to work, that's going to change the way the family process is functioning. When we change work incentives, that's also going to be related to families' access to quality care. So these are not independent channels. They're all going to be kind of complements or substitutes for each other. So after we've kind of gone through that framework or that set of mechanisms, what I can tell you is that in general, the very general prediction that we have from the literature is that when you're considering how best to transfer funds to families, it's generally better to give them cash than to give them in-kind transfer. The reason for that is when you provide an in-kind transfer, you're essentially assuming that the family is going to need that service. So if I, have a $5,000 and I'm deciding whether I want to, for example, give the family $5,000 cash or whether I want to give them $5,000 in food benefits, generally speaking, you're better off giving them cash because you don't know as the policy maker whether that family has access to a garden, right? You don't know whether that family necessarily is a one-parent family or a two-parent family where one of the parents is kind of using a lot of their labor to cook, whereas the other family, by necessity needs to eat out a lot of the time. So in general, giving families cash offers them more flexibility and has the potential to increase their welfare more than an in-kind transfer of the same value. So that's the general rule. However, there's a big complicating factor to this, and it's what we would call in kind of economics or policy world, the supply side response. This is going to be especially true when we're talking about early childhood education. So from the family's perspective, it might be better for us to give the transfer in terms of cash rather than using it to fund their early childhood education. However, if funding the early childhood education is going to have effects also on the providers themselves by infusing more money into that industry, then we could wind up with a situation that we're actually better off giving the money in terms of the in-kind transfer and using the money, for example, to fund a subsidy program. And I'm going to argue that that's kind of exactly the situation we're in the childcare market. Okay, so that kind of gives us some theory and some context to think about how to compare these different transfer policies and which type of transfer policy we're better off with. So let's look at some research on these various programs and compare what kind of the empirical work where we actually go out and look how families respond and how kids respond to these different policies to get a sense of what the research tells us. So I'll start off with summarizing some of the research on family tax credits. This research is predominantly drawn from studies on the earned income tax credit here in the United States, which is another big tax credit. It's primarily directed to families with kids, and the structure is very similar to the child tax credit. And also, the literature also draws on similar family tax credit programs in other countries such as Canada. So for example, Canada's longstanding child tax credit, or equivalent to the child tax credit, is almost identical to the expanded child tax credit that we had in 2021 here in the United States. So a lot of this research comes from that context as well. So generally what we find is that when you give families more money through a family tax credit, we see positive impacts for the kids. We see improved educational outcomes, improved test scores. And I'll kind of leave the caveat there based on Dr. Jackson's discussion this morning that, of course, test scores are not the be all end all, but we do see generally when we give families more money, we see improved test scores for the kids. We see improvements in maternal health behaviors like smoking and take up of prenatal care. We see increased spending on food and education, and there's some evidence that families actually reduce their spending on alcohol and tobacco when you give them more money through tax credits. The idea being that stress is relieved and they're not kind of needing to spend on alcohol, tobacco, or they even have more money to engage in recreation, like go to the movies or do something like that, where it's essentially a time substitute for the time you would be spending at home smoking and drinking or at a bar or something like that. We also see more savings in debt. And then there's evidence that the effects are persistent. So when you give a child's family more earned income tax credit when the child is young, we see long-term effects on the child's college going and graduation rates. So just to kind of also refer back to Dr. Jackson's talk this morning about, the difference between a program being good in the short term versus the program being good for kids in the long term as we track them into adulthood. So the tax credits, just to sum up, are generally, there's a kind of strong research base supporting these tax credits and how good they are for kids. But publicly funded childcare, on the other hand, things are a bit mixed. So one thing that is demonstrated when we fund publicly funded, when we fund childcare programs, whether it's through a universal pre-K program, a universal childcare program that we see in other countries, or the PFCC subsidized childcare program here in the United States, one thing that is true across the board is that when you direct funding to these programs, moms go to work. So that is kind of like that one is a very well-established fact. However, when we look at the effect of these programs on child outcomes, the evidence is mixed. So on the one hand, and this is kind of drawing again on Dr. remarks from earlier, evidence on well-funded, wraparound, highly standardized programs like Head Start, for example, is very positive. When we fund these programs, we see positive effects and we see effects that persist into adulthood. I won't kind of go into detail there because you heard a lot about it already. However, when we look at other universal programs, like a universal preschool program, for example, we have evidence from New York City, Florida, Canada, and Tennessee, the effects are more mixed. In some cases, we see that when we launch these universal pre-K programs, there's improvements in educational health outcomes for kids. But there's also pretty strong evidence from Canada and also new evidence from Tennessee that the launch of some of these programs actually leads to declines in some of the outcomes that Dr. Jackson was talking about this morning, specifically these non-cognitive skills, and some evidence that there's negative outcomes into adulthood. So, one kind of really controversial and important study in this literature looks at the launch of a universal preschool program in the province of Quebec in Canada. And using some of those methods that Dr. Jackson was discussing this morning, the authors have published kind of two studies, one looking at the immediate effects on cognitive and non-cognitive skills, so behavioral outcomes for kids in their kind of elementary school years, and then a second follow-up study looking at the effects of the launch of the program on incarceration rates. They find negative effects on those non-cognitive skills in the short term and persistent effects into adulthood on incarceration. And then there's also several studies on the CCDF program here in the United States, the targeted subsidy program, where we've essentially kind of paying some of the costs of attending a childcare center or family provider for lower income families. The evidence on the CCDF program in particular is pretty negative, really. Most studies show worse cognitive outcomes at young ages for kids, more behavioral issues for kids, and there's also evidence of worse mother-child relationship. So why could it be that the CCDF program leads to bad outcomes? I'm a huge proponent of publicly funded childcare, but I think there is, a lot of work we need to do on how we implement these programs. And I want to talk us through a little bit of these kind of, specifics now for the rest of the talk. So let's think a little bit about, let's try and explain for ourselves why we might see this negative connection between subsidized childcare, in particular the CCDF program here in the US, or the publicly funded childcare program. Well, again, that's what we call it here in Ohio. Why might it be that we see negative outcomes of this program? And so thinking back to that framework I provided a few minutes ago, I think there's a few different mechanisms that we can imagine. So first is that work incentive channel. We know that when we expand the publicly funded childcare program here in the US, moms go to work. What kind of work are the moms going to, right? These programs are in Ohio, the income eligibility cutoff for the program is 142% of the federal poverty line. These are low earning households, many of whom are working in what we would think of as a low quality job, inflexible, unpredictable hours, potentially physically demanding. So if I give a family a program, a publicly funded childcare program that essentially moves the parent into a bad work situation, that is not going to probably be good for the kid. It doesn't take too much for us to think about how that might be the case. That leads into this family process channel that if I'm now moving out of, I was staying home with my kid, I now have access to the subsidized childcare. I'm using the care to go to work at a kind of inflexible, potentially dangerous job, that it's going to be bad potentially for how I'm interacting with other people in my household. And then the third channel that we can kind of think about helping to explain that negative relationship between the PFCC program and child outcomes is the effect on the access to quality childcare. So that's what I really want to think about when we're thinking about the subsidy program here in the US. So this is a graph that I just drew up of the reported subsidy payment rates by state for a full-time infant care in 2019. So essentially, we've got the amount of the subsidy rate along the bottom axis here. This is how much the state is paying the provider for each kid. And then up here, we've got the number of states in each bin. So what you can see is that we've got a significant number of states where the monthly payment for full-time infant care is about $500. We've got a couple states where about 5 states where the monthly payment is over $2,000. So even though we know there's big differences in the cost of care across states, across location, et cetera, I can tell you that these differences are not explained solely by geographic or underlying cost of care differences, right? There's nowhere in this country where it costs $500 a month to provide quality childcare for an infant. I think many of you on the call know that to be true. I don't need to tell you that. So we've got a situation where the subsidy rates are really low in a lot of the country. So think back to when I introduced this program earlier in the talk and kind of illustrated to you that it's a relatively small program. So the CCDF program across the country funds care for about 1.5 million kids. It's not a lot of kids. However, a majority of providers accept subsidy care. Here we've got, for example, in Ohio, we've got 75% of all licensed ECE providers in Ohio accept subsidized children, and over 95% of home-based providers in Ohio accept subsidized children. So even though the program is small in terms of the number of kids it serves, in terms of the number of providers it serves, this program is massive. When we are underfunding a program that impacts over 70% of the childcare market, we're going to wind up with a situation that the program is not going to lead to good outcomes for the kids. Underfunding of subsidized care strains providers' budgets. If I'm a provider that's trying to provide care to an infant, I'm only getting paid $500 a month to provide that care. I'm either going to need to I'm going to need to cut my costs, I'm going to need to make a loss, or I'm going to need to charge more to other private pay kids in order to subsidize the kid who's on the publicly funded childcare program. It's also true that because of the way the subsidy rates are set, the low subsidy rate that the state set can really anchor the market rates for private pay children. So to the extent that providers set the rate they're going to charge everybody based on what they're getting from the state, if you are a state and you underfund, you under-subsidize children through your publicly funded childcare program, you're going to wind up with a situation where you're essentially bringing down and drawing down the charges for all kids in the childcare market. It's going to lead to chronic underfunding. Low subsidy rates also segregates the childcare market because it means only the lowest cost providers are going to be willing to accept children. And it's also true that in most states, including Ohio, the CCDF program, or the publicly funded childcare program, is intertwined with the quality rating improvement system and licensing rules. These programs involve a lot of administrative work for providers, and it strains providers, especially those from low-income communities. Okay, so that's kind of where we are. And I want to finish on what, hopefully a more positive note by just emphasizing some of the things that we can do at the state and local level to help address some of these issues. So let's move back to the child tax credit for just a second, and then I'll finish talking a little bit more about the publicly funded childcare program. So these are my recommendations. We need at the state level to push for state refundable child tax credit programs. You can see the map on the right illustrates that there are several states and a growing number of states that offer their own state level child tax credit programs. This is something we can do in Ohio. Governor DeWine approved and funded a small expansion to our state earned income tax credit in his last, I think in the last 5 years. So this is something he potentially would support. This is something that I think we as advocates can really kind of work to push for. The research is definitive that these programs are good for kids. Turning back to the publicly funded childcare, I've got 3 recommendations that I'll close with. The first recommendation I have is to push states to increase subsidy payment rates. So the Child Care Development Fund program, or the publicly funded childcare subsidy program, it's kind of an interesting program. It's what we call a block grant program, meaning that the federal government transfers money to states in the form of a block grant. States then have a huge amount of leeway to be able to make decisions about how the program is administered. One big one is how states choose to set their subsidy payment rates. So most states use what we call a market rate approach, where they survey providers, say, what are you charging for childcare in your business? And then they use that to benchmark the subsidy rates they're going to pay. However, what we know from the childcare industry is that providers are not always and are rarely actually charging families the true cost of providing care. So if we're using the market rates, which are already depressed by the fact that families cannot afford to pay for care, if we're using those market rates to set our subsidy rates, then they're going to be artificially low, and we're kind of defeating ourselves a little bit by chronically underfunding the program. So I recommend that we push states, and push Ohio in particular, to move to a cost-based method of setting their subsidy rate, which in turn will lead kind of by definition to increase baseline subsidy rates in the CCDF program here in Ohio. Next recommendation is push states to simplify the administration of their publicly funded childcare programs and related QRIS and licensing rules. So administrative costs of the CCDF program are not, and program participation are not reimbursed. So as I was just saying, the way we subsidize providers for accepting publicly funded kids, we identify what's the market rate the providers are charging to provide care, and we reimburse the providers, we subsidize the providers using that market rate. Thus, the subsidy rates we're paying Maybe they cover the cost of providing care. They certainly do not cover the costs and additional administrative costs that providers are taking on in order to participate in this program. And these administrative costs can be huge. Providers are small businesses by and large. For them, time is money, and time is also children's development. If we're talking a home provider who is a sole owner operator, the sole employee of their business, every minute they have to spend on meeting the state's requirements for these programs takes away from time they are spending with their child, with the children in their care. So my recommendation is simplify. I think there's a lot of ways. I know I'm running out of time here, so I'm not going to go into all of these. But doing things like, for example, reducing the number of stars in the QRIS systems, so that instead of having 5 stars like we have here in Ohio, maybe we can make do with 3. Reduce the number of payment categories. Reduce the requirements on providers to provide data. In Ohio, we're asking providers to provide their rates, for example, in several different systems. We need to work to kind of simplify those systems so we can minimize the burden on providers. And then the last one is paying on enrollment rather than attendance. So the way we administer the program here in Ohio, a provider receives subsidy for the days that a child attends care. So if the child doesn't come because the parent is sick or the kid is sick, the provider is not going to get subsidy payment for those days, even though the provider has to continue paying the cost for those days. So if we paid on enrollment rather than attendance, that's going to help the provider's bottom line, and it's also going to simplify the program. And then the final recommendation I want to end on is I want to push states to recognize the market realities when they implement their QRIS system. So I'm a huge proponent of QRIS. I think measuring and requiring quality in childcare is of the utmost importance. It's also the case that providing child quality care costs a lot of money. And there are, because of the way our society is structured and the economic segregation we live in, there are large swaths of this country where families who live in the vicinity of a provider cannot afford to pay the cost of meeting the QRIS recommendation or the QRIS requirements. So we need to recognize that when we're structuring our QRIS programs. So I will end there, and I'm looking forward to some discussion as we go forward. Thanks.
Lauren, thank you so much for that. Yeah, absolutely outstanding, as Dr. Justice says, presentation. I learned so much just from this talk, and about tax incentives and social policy programs that, yeah, I've just learned so much from this talk. So thank you. And I think that you really kind of demonstrated how the impact of these programs goes full circle, right? We started out, what are the outcomes for children? But you demonstrated that it's not just about kids, right? There are effects for parents. There are effects for our workforce system, like for families, like a whole slew of things, right? It's really about the system as a whole. And what kind of kept coming up for me over and over as you were talking to was, I'm thinking about kind of the values that we impose on families by making the decisions, right? You talked about cash assistance versus in-kind assistance. And I'm wondering what you think if we were to give families the choice and really kind of give them the choice to make the decisions about how they use those financial benefits, what kind of outcomes might we see if we took a different approach?
Yeah, great question. I mean, most people are going to choose cash, right? Everybody wants cash. I'll take some, like that's the thing. People want cash because they know what they need best. However, there are major market realities. Childcare is a great example. Housing is another great example, where giving families cash is not going to solve the underlying market failures that we are contending with right now, right? Why are we not investing? Why is there not sufficient housing to meet need? Why is there not sufficient childcare to meet need? those problems I don't think are going to be solved by providing cash alone. So even though I am a very strong proponent for giving families cash, I think a lot of the reason we don't give them cash is because of these kind of implicit values that we are using when we structure our social safety net. The idea that families are just going to spend it on, beer and junk food, and we can't, poor people can't be trusted to make good decisions for themselves. I think that is hooey, and I hate that. I hate that perspective, right? But I do think there are kind of market realities that we need to think about when we are allocating funds, but across these different and between these different programs.
Thank you. There's a question in the chat. Are there policies you'd recommend that could be advocated for a more local level than statewide? For example, could a city provide some kind of tax credit or voucher for early childhood care?
That's a great question. And I'll be honest, I don't know a lot about kind of things happening at the more local level. But I do know there is a lot going on. There's been a push among many cities and mayors, including former Mayor Nan Whaley of Dayton, to sign on to these kind of city level universal basic income proposals. So I don't know. I think maybe there's 1 or 2 cities in the US where there's been some funding associated with those programs. A universal basic income is like a tax credit. Essentially, we're just transferring money to families, no strings attached. So I think there is leeway to advocate for these programs. Here in Columbus, I know, and in Franklin County, there is a lot going on to try and fund things like universal pre-K in the Columbus City schools, for example. So I do think there are opportunities at the local level to push for these things.
There's a question. Could you kind of explain again? I know you spent some time on this, but explain again the cost of an in-kind transfer and kind of the differences there.
Sure. So I think there's different types of in-kind transfers. An in-kind transfer is any transfer that's not just cash. So on the one hand, the one end of the spectrum, we have what we'd call cash-like in-kind transfers. These are voucher type programs. So SNAP is a great example for this. If I give you $100 in SNAP, if you go to the grocery store, you can essentially treat that like cash, right? So it's a program that provides an in-kind transfer that's very cash-like. For a lot of families, they're going to be essentially indifferent between getting $100 in actual cash or $100 in SNAP benefits, because I spend at least $100 on groceries a month anyways. It's essentially totally transferable. But for example, if OSU told me, oh, I'm going to give you 90% of your annual salary in grocery store vouchers instead of cash, I would not be okay with that, because I don't spend that much of my money at the grocery store every year, right? So in that case, I'm going to really have a strong preference for cash. So that's kind of one type of in-kind transfer. On the other end of the spectrum of in-kind transfers, we have in-kind transfers where they're not vouchers, they're instead systematic. So this would we would include things like funding for the Medicaid program, where families are essentially getting universal health care in some way through Medicaid. Education is K-12 education is a great example of an in-kind transfer that is systematic. We're funding an entire system. We don't have a situation where we're just giving families vouchers and they go out into a private education market and spend those vouchers how they like. Now, things are changing, right? With the advent of charter schools and things like that, we're moving some of our education spending into more voucher-like systems. But for the most part, most kids K-12 in this country are still educated through a systematic in-kind transfer, where they aren't shopping for a service, right? It's not like we're giving them money that they can then use to offset their costs of buying the product in a private market. We're providing the service itself. So you can kind of think of, we've got cash over here, and then we have this spectrum of in-kind transfers that go from very cash-like in-kind transfers like SNAP all the way to K-12 education, which is more systematic in-kind transfer.
Thank you. There's another question. How did Ohio come to tie PFCC to child attendance? Are there other states we can learn from to ensure that programs are adequately funded, no matter the personal situation of an enrolled family's life? This would also greatly alleviate administrative burden.
Great question. I could have planted that one. I love that question. So most states do pay on attendance. It comes from I think it comes from a lack of understanding of the way a childcare provider works, the business model of a childcare provider, and a lack of understanding of the way we fund the program interacts with these other regulations we've placed on providers, notably child teacher ratio regulations, and then also we talked about this morning, the scarcity mindset, right? A lot of state legislatures don't want to pay for a service that they're not getting, right? There is a real attitude, I think, in some circles that providers are somehow gaming the system or something, trying to like take advantage and get paid for kids who are not actually there, providing service for kids who aren't actually there. And so I think those three kind of, conditions have interacted to create a system where we insist that providers are kind of keeping track of attendance so that we only subsidize for the days the kids are actually there. Of course, that model does not work at all because on the one hand, even if the kid doesn't show up, I still have to bring my teacher in, right? Because I still have to obey this other regulation the state has put on me, and rightly so, of the teacher-student ratio. But in not kind of acknowledging that additional regulation in the way we structure the funding stream, we're really putting providers in an impossible situation, in my view. I will say that there are states who are kind of recognizing this and moving away from an attendance-based payment to enrollment-based payment. So this would be whatever the kid is signed up to attend, you're going to pay for that, regardless of whether the child comes or not. And I think you're right, that's going to reduce a lot administrative costs on the provider, administrative costs on the state. It's also the case that most states have contracted with third-party providers to help facilitate the attendance tracking, which is another cost going from our state coffers into some other private firm, some private like tech firm for the most part, right? Like a developer company. So I think there's a lot of savings that could be had. Again, this is like moving away from this scarcity mindset where I don't want to spend an extra dollar now without kind of considering all the savings I'm going to have later on, both like immediate savings in terms of ameliorating these administrative burdens, but also the long-term savings on having a robust childcare market where providers can count on a consistent revenue stream from the state.
Thank you. And we have about 2 minutes left, and I have one more question in the chat that I think we can close with. So is there any research that shows whether families decided to opt out of the workforce and thus childcare when they started to receive monthly CTC payments? I'm curious if there might be a demand side impact in that way.
Great question. So there is research that's starting to bubble up. Obviously, the expanded CTC is a very new policy. And so, the research community is trying to keep up and catch up a little bit to evaluate that shift. So I will say the way the earned income tax credit is structured, and also the way the child tax credit that we're left with is structured, like a lot of the justification for having that phase-in period and having the work requirement is to essentially avoid what you're talking about. Like policymakers and certain policymakers are very concerned that if we give families tax credit, they're going to opt out of the labor force, which is why we kind of do that phase-in period and that work test to be eligible for the credit. So there is some evidence that in other contexts, Canada in particular, that moms sometimes do opt out of the labor market when they get more generous credits like this. I think we need to really, and this gets back kind of to your initial point, Sunny, really think about like the values we are imposing on families, right? I'm a career mom. I love it. I wouldn't trade it for the world. And it's incredibly difficult to work and have a small child at the same time. I think a lot of people understand that reality. I don't think it is necessarily good that all our policies are kind of trying to push parents into the workforce as soon as possible, right? I think it's good for women to participate in the labor force. I think it's incredibly important, but I think there's other ways we can do it besides kind of insisting that they do in order to receive these incredibly important social policy and social safety net programs, especially when we are requiring them to go to work in incredibly low quality, like unregulated workplaces, like that seems just like an impossible situation that you're putting people in, people who are already vulnerable. So I think we really need to do a lot of, the talk was really about like specific and these little policy levers and stuff, but I think there's like underlying philosophical and value discussion that really needs to be had in our country about this insistence on like work productivity being the be all and end all for everybody, and the undervaluing of care, whether it's being done by an early childhood educator or whether it's been being done by a family member, and a woman most likely.
Well, that is, I think, a really great last thought to end on for us all to take with us and, ponder and come up with solutions, right? So I want to thank you for your time today and your excellent presentation, Lauren. I think I'm seeing lots of thank yous in the chat, so thank you for that. And just a reminder to folks to fill out the survey that'll pop up and join us in our last session this afternoon.
Thank you so much. Thanks for the great questions, and thanks for moderating.